Hello, and thank you all for joining today's exciting Neglected Tropical Diseases lunchtime talk. I hope you're all well at this time. And for those of you who do not know me, my name is Alyssa Mariner, and I am the Communications Officer with the NTD Communications team. Just a note, could everyone please remember to mute themselves during the presentation? And just so you're all aware, we are recording this talk so that we can share it with you at a later date. So today I am very excited to introduce Cathy Stephen, Andrea Pregel, Amy Clark, and Geordie Woods. Today they'll be presenting their talk entitled COVID-19 Response, Making Social Behavior Change More Accessible and Inclusive. And today they will present that the Ascend COVID-19 Response Action Learning Review, which focused on how the Social Behavior Change mass media campaign was made more accessible and inclusive. So if you have questions that pop up along the talk, please put them in the chat and we'll be monitoring that, and there's time for question and answer at the end. And now I'll just pass things over to the presenters to kick things off.
Thanks, Alyssa. I'm in control of the slides, so if anything goes wrong, please let me know. So I'll try and progress as we go. And thank you for the introduction. Maybe for those of you who don't know us, I'm Cathy Stephen. I'm the Global Technical Lead for Behaviour Change. The other presenters are Amy Clark, who is the Team Lead for Knowledge, Innovation and Learning. We have Andrea Pregel, who's a Global Technical Lead for Inclusive Health, and Geordie Woods, who's the Director of Behaviour, WASH and NTDs. So it's quite a collaborative team. But we also want to say we mustn't forget two other big contributors to this piece of work, who were Chantel and Albie. The three of us together conducted the interviews for this learning piece and wrote up the findings, and without them, this piece of work would never have happened. And also a big thank you to the contributors to this piece of learning from the Ascend stakeholders and our partners, M&C Saatchi, Geopol, and Ministry of Health in a range of countries. So we're going to present on this piece of learning, which was conducted in 2020 and written up this year. There were whispers around the organisation about this fantastic collaborative effort between the Ascend COVID Flex work and the PS2 social inclusion team to make their behaviour change campaign more inclusive and accessible. People were talking about this wonderful work and the way we came together across the organisation. So at the end of last year, we decided we wanted to capture that learning and draw out those lessons and talk about it with confidence. So that's what we'll present today. Yeah, and I'll hand over to Geordie to kind of kick us off with the slides. Thanks.
Thanks, Cathy. Good morning, everybody, or I guess good afternoon, or good day, depending on what time of the planet you're on. I'll just give, probably a lot of you have maybe attended or seen another presentation that myself and Leah and the rest of the team have given, but I just thought I would give a quick brief of what the COVID response was. So in April of 2020, while the Ascend West and Central Africa program activities were basically on pause, we began working really quickly with ministries of health and national COVID task forces to identify the gaps and understand what the national COVID-19 responses of Ascend countries needed to be. So we were trying to find out what were the holes that we could plug. And that largely ended up being mass media and the communication gaps. So the COVID-19 was needless to say, a big adjustment for the team, working entities, working with different partners, ministries, and different timeframes quite a bit quicker. So we had to really sort of come together in this collaboration with the inclusion team, and PS2 was really important in working at scale. So the other thing I will say is just also all of the partners and in-country staff were really played a big part of getting this out to date. So so really just in summary, the biggest part of this 6.8 million pound COVID flex response was largely mass media and community level activities. So the next slide, please. And I won't read through all these numbers, But again, this was very much a different type of response for our normal work. Is sort of very much an emergency response. But overall, we worked in 10 countries and we reached over 23 million people through just the community level activities. And then through the mass media campaigns, it was again 10 countries, 49 languages, and 120 million people reached. So a lot of this was done with our partner MNC Saatchi in terms of really rolling out with mass media partners and all of the media buys. If anyone is interested in learning more about sort of the nuances of this, there was another presentation in March, and happy to share those slides, or you can go back and look at the recording. So back to Amy.
Great, thanks Geordie and Cathy. And I'd also like to make some personal thanks as well. So yeah, Chantel and Albie done a fantastic job in helping us get to where we are today. So a huge thank you from me as well, and to everyone involved in this great piece of work. So here I just want to touch on the drivers for this piece of work. So within Ascend, we've adopted an overarching learning strategy, which is called Collaborate, Learn and Adapt. And this is really a set of principles to promote data analysis and use and encourage a continuous cycle of learning throughout the NTD programme management cycle. So also referred to as adaptive management. So this is a particular focus area for the donor of Ascend, which is FCDO, and also the third party monitoring supplier, which both of whom are looking at evidence that we are adapting in response to lessons learnt. So in light of this, we kind of felt it would be really beneficial to take stock of the fast-paced work, which Geordie's just outlined, and continue the collaboration across the directorates to kind of pause and reflect on what happened and really ask, how did we make our behaviour change campaign more accessible, and try and systematically capture some of the lessons learned. So we did this by developing a terms of reference to start with, to map out the process up front, identify some learning questions, and in the bubbles on this slide, you can see what we wanted to capture. So it was really the feedback on the processes that we used, exploring the benefits and the challenges of embedding inclusive and accessible design, and really do a bit of a deeper dive and dissect the design process and understand a bit more about the so what and the potential lasting legacy of the project for inclusion and accessibility. So we did this by conducting 20 key informant interviews from the Ascend Flex programme. So this included staff from lots of different organisations, so ministries of health, consortium partners, and they were selected based on their involvement and focused on the inclusion and accessibility components of the campaign. So we analysed the interview scripts to look for emerging patterns and themes, and then additional information was also gathered through a review of documents and communications. So next slide, please. So looking at the design process for this then, so following the go-ahead from FCDO that we could adapt Ascend to respond to the COVID response in West Africa, the first step in this process was to develop 11 concept notes. So this was done by the project teams just in 10 days. So they worked night and day to get this done. So huge congrats to all those involved, because it was really a monumental effort. So given the rapid turnaround on this, objectives for inclusion and accessibility were conveyed in the concept notes, but the specific details of the approach, the requirements and the expectations were not specified at the very outset. But once we got approval that we knew this work could definitely go ahead, it was through guidance, repetition, consistency on how to mainstream to get this embedded into all of the country campaign plans. So this guidance really helped the project teams to absorb the principles of inclusive design up front. And as you would expect at the design stage, there was lots of consultation and stakeholder engagement was really key with our partners, so M&C Saatchi, the consortia partners and governments as well. And Andrea consistently supported and guided this process. Many of the partners had not done this work before, so it was a real learning experience for them. So I'll hand over to Andrea now, who'll run through some of the specific inclusive and accessibility guidance that was provided.
Wonderful, thank you, Amy. So yeah, we provided a lot of technical guidance to partners, in particularly M&C Saatchi. We had a few meetings at the beginning to go through key aspects and principles that had to be considered to mainstream accessibility and disability inclusion throughout. And key areas of guidance mainly included three key aspects. One was around the variety of communication approaches. So, for example, having TV commercials, radios, billboards, posters, leaflets, digital media, with the idea that a combination of formats is usually a good strategy to increase the likelihood of different people being exposed to key messages, including people with different types of impairments. We then, of course, talked quite a lot about accessibility of the materials. So, for example, having simple, brief, very clear messages using plain language, trying to combine written messages with visual information like illustrations and pictures, but also considering aspects like color contrast and the size of text. And the size of different visuals like logos and other icons. And then we talked about videos, for example, the importance of embedding captions in videos, using sign language interpreters, and also describing anything that appears on screen but is not spoken necessarily, trying to have an audio description of key elements and key messages. And then we also talked about representation and participation. So trying to, first of all, in broad terms, making sure that all the materials were relevant for the specific context. So, for example, thinking about the clothing and the fabric of people in the illustrations, making sure that the clothing are relevant for each specific region, having materials in different languages, including minority languages, as well as specifically on disability, trying to portray people with disabilities in a positive way. And also keeping in mind some of the challenges. So, for example, we wanted to avoid portraying people with disabilities doing some negative actions. For example, not wearing a face mask, to avoid associating people with disabilities with COVID and potentially spreading COVID. So it was a very delicate balance that we had to achieve there. And of course, we talked about involving people with disabilities in the process, and organizations of persons with disabilities in the process as much as possible. But of course, there were some challenges that that were already mentioned in terms of the very quick turnaround, and some of the limitations that we'll talk about later. Next slide, please. We also provided good technical guidance in the form of tools and resources that partners could consult and refer to, including, for example, the WHO guidance on disability and COVID-19, the resources that were produced by IDA, the International Disability Alliance, and IDDC, the International Disability and Development Consortium. They did together a campaign on COVID-19 and disability, and there were great resources on accessibility of COVID messages, for example. But we also shared internal resources that we had. So, for example, our own disability inclusion and COVID-19 guidance, as well as the resources on accessible communication and accessible design that were produced by the online design team. They're available on the website, plus a few external resources, for example, how to incorporate a sign language interpreter in video, or what kind of fonts are more accessible than others. So we did provide a lot of this guidance at the very beginning, and the whole idea was to equip M&C Saatchi and partners with basic principles and knowledge and resources to really embed accessibility and inclusion throughout. But we also wanted to provide really hands-on support as much as possible in the review and development of materials and assets for different countries. I couldn't participate in all meetings, but we tried to attend as many as possible. So we have some examples from Nigeria. Next slide, please. So here we have, for example, some images, some messages that were developed initially by MNC Saatchi on the left-hand side and the center. These messages had a choice of font and colors which weren't necessarily great, and eventually, after feedback, we managed to change some of these. And for example, we had a more balanced font, less compressed, less thick. I think we had a whole week of discussion with MNC Saatchi on what an accessible font looked like and the shape of letters, for example, for people who are dyslexic. And this is still not ideal necessarily, because, for example, the type of A in the title is different from the type of A in the sentences below. But it was all about finding the right compromise in the short time available with the resources that they had available, for example, with their font library, and trying to incorporate key principles in that process. Next slide, please. So here's an example on color contrast. On the left-hand side, there's a poster which is a very bright yellow background and some red text, which is also a bit compressed and it's not really legible. And so after feedback, we managed to change the background to a sort of calmer yellow and darker text using a dark color and a different type of font. And the same is on the right-hand side with a very sort of light red and compressed font. And we then managed to go to a different type of font and a darker tone to increase readability and color contrast. Next slide, please. Again, from Nigeria, this is a poster that was produced. Here we try to combine written information with visual information to make it as simple as possible, as clear as possible. The initial version here had, I think, a woman wearing a T-shirt with short sleeves and without having a head cover. And following feedback from the country partners, it was agreed that that was not necessarily appropriate for that specific part of Nigeria, so the cultural aspects were changed. But also we tried to incorporate very simple and straightforward visual information to support the key message. So for example, here to describe to associate the concept of distance, we use the rickshaw, which is a very popular sort of transportation form of transport in Nigeria, and so we try to visualize the distance with an object which is in the everyday life of everyone in that context. And here we still have the rickshaw. It's the other side, the other way around, because the government of Nigeria changed guidance on social distancing while we were in the creative process. So that's a good example of how we had to quickly adapt and be on top of things. But again, we maintain that idea. This is a still from a TV commercial. On the bottom, the right-hand side, you can see a sign language interpreter. Again, this was not added in the original video, and therefore we had to find a way to include it afterwards. So ideally, it would have been nicer to have it bigger, but we couldn't make it bigger afterwards because of some other things appearing on screen. But it was a good example of how, even though guidance was provided at the beginning, it wasn't necessarily incorporated straight away, but then following feedback, including feedback from the ministries that they wanted to have that the sign language interpretation, then it was added in, and so the feedback was taken on board. And we also have some sentences appearing on screen. So in this case, there was a voiceover sharing key messages like wash your hands, keep your distance, and we made sure to have visual information and written text appearing on screen at the same time to increase accessibility. Other examples from Benin I quite like. In Benin, we had TV commercials in multiple languages, including using captions and sign language. And there were also other assets like training materials for community health workers, religious leaders, traditional leaders, and there are some good examples of positive portrayal of people with disabilities. So in the next slide, for example, it's a TV, it's a still from a TV commercial. In this case, again, the sign language interpreter was added later on, but again, good, the feedback was taken on board and it was embedded. But also here, what I really love about this is that the captions changed color. So the caption would appear in white at the bottom, and then this was a singing video. So there was a voice singing key messages, and as the voice as the song continued, the captions would change color from white to yellow, so that people would follow along. And so that's a very good example of how the idea of captions, which is a pure accessibility component, was thoroughly embedded and taken on board and even transformed in something more interactive for everyone, not just for people who might rely on captions to follow the video. And still from Benin, I think we have an example of a training guide for health workers. There's an illustration of community health workers distributing masks, and they're interacting with an older woman using a walking cane. I think the cover of this slide deck also has some images from Benin where there's a wheelchair user and some other people. So that's an example of where people with disabilities were represented as part of their community on an equal basis with anyone else, but they were front and center out there. And next slide, I think this is also a very good example from Guinea, where a representative of the National Union of Blind and Visually Impaired People was engaged to be one of the protagonists of these videos. So these are commercials that were aired to sort of promote good practice for hand washing, and so the message was not about disability, but it was about having someone with disability as the key the key protagonist in this video. And so I think there was a good example of interaction with the local disability organization and making sure that people with disabilities were engaged and positively sort of portrayed in these assets. I think next slide. That's over to you.
Thanks, Andrea. So through Andrea's consistent guidance over time, inclusion and accessibility was embedded into the campaign materials, as you've seen from all the different images. But also the stakeholders took on board this new knowledge. They internalized the learning and became more independent and confident about using the principles, especially of accessibility. And that meant the technical support could slowly reduce and become more targeted. And on screen are two quotes from the interviews that I'll read out. So MNC Saatchi said, "This more inclusive campaign has provided a great stake in the ground for how we should develop communications with inclusion in mind. This should form our starting point for future campaigns in which we build on our previous work and look for ways to go further in developing communications which are inclusive." So that was really great to see that MNC Saatchi had taken on board all that learning and we're really going to use it in the future. And someone from Sightsavers said, "We knew some of the theory, but the technical guidance trained our eyes for accessibility and inclusion." So the learning review also found that each of the project stakeholders faced a range of drivers and barriers to make their campaigns more inclusive and accessible. So the Ascend project stakeholders had to balance reaching a wide enough audience whilst also embedding and mainstreaming inclusion and accessibility. They had to balance time and budget. It was a very short and intense time. And it was also a new approach of considering accessibility, and stakeholders had to adjust and adapt to this kind of new approach. And of course, we had the Ministry of Health. The Ministry of Health were the key decision makers on final content and visuals, and they had existing COVID-19 response strategies and existing communications plans, which often prioritize reaching scale. So that had to be embedded within that. This was a new way of working for the Ministry of Health with creative agencies and an inclusion advisor who were both outside those Ministry of Health structures. So this required time and buy-in and discussions. I think from the range of interviews, we found that none of the stakeholders opposed this drive for inclusion and accessibility, but some stakeholders had more interest than others and kind of drove this ambition for more accessibility and greater inclusion. Anyone who saw the last presentation on the COVID-19 Flex program will remember this image on the screen. It's of a person sitting on the floor looking just overwhelmed with information and trying to make decisions. And we know that in a crisis, both our staff and people we work for struggle to absorb information and make those decisions. So what we found was that the approach to giving technical advice was very important, and it was actually very successful in this piece of work due to the effective communication approach that was used. The most important factors to success were about delivering that advice in a consultative communication style that was very clear, accommodating and approachable, so it didn't feel intimidating. But also people really strongly preferred verbal advice. So I think because there was this fast pace of work with a huge number of emails, there was an email overload, there was loads of last minute calls, and people preferred having that space to talk about the technical advice, discuss it, and make decisions collectively together rather than having that written information. But also the technical advice was very relatable and practical. So this included explaining what was being recommended, why it was important, and how to make the change. So humanizing that advice and creating empathy for the change that was needed to make our materials more accessible and inclusive. So yeah, effective communication was very important. Another key learning from the piece of work we did was about compromise and adaptation. So we know this was a very rapid response, and compromises had to be reached along the way. It was the first time that partners had focused on embedding accessibility and inclusion, and they had to do this in multiple countries at many different levels across many different assets and materials that were being produced. So there were some limitations in being able to mainstream inclusion and accessibility across everything, which offers some important lessons for us, I think. So on screen, you can see an image from the Ghana social media commercial, which targeted school children. This social media campaign focused on using mobile phones to stay in contact with friends during lockdown. And the creative design was intentionally colourful and fast-paced to motivate and engage children. This was very successful in reaching children, yet some accessibility had to be compromised. So some positive aspects of the technical advice were incorporated, such as color contrast and captions, but the font could have been more accessible, and some of the flashing lights and fast transitions between frames could have been improved. And there are other examples in the learning brief. If you get a chance to read it afterwards, we'll share that around. But there were other times when, with more budget, time, or ability to compromise, we might have had slightly more accessible or inclusive visuals, images, or messages. It wasn't perfect. And a final piece of learning we found from the piece of work was about the engagement of people with disabilities themselves. We know this was a short time frame, and there was a limited engagement of people with disabilities themselves in the design process or organizations that represent them. M&C Saatchi, for example, had to really condense the stages of their design process. And we found that most of our insights for the design of the materials came from our country teams, like our country principals or our Ministry of Health, and also from the Social Inclusion Advisor. There was an example in Benin where they conducted some formative research, but again, there wasn't time, unfortunately, to coordinate with organisations representing people with disabilities. And again, there was no time, unfortunately, for pre-testing the materials with target audiences, including people with disabilities. However, there was good involvement of people with disabilities in the monitoring evaluation phase, which Geordie will talk about now.
Thanks, Cathy. Yeah, so I won't go into all of the exciting outputs of the monitoring evaluation, but I'll touch on sort of how it was really inclusive. And I will also say that from a monitoring evaluation perspective, not only I think it was sort of new for us and innovative in terms of the inclusion part, but also for how we were measuring the social behavior change campaign. So just quickly, sort of a bit of background. The campaign, the measurements that we were looking at outputs. So the number of campaign assets designed, so the number of posters, billboards, things like that. Just actual numbers of things that were designed, and the reach of those things. So we had a media partner, Simply Black, that provided the reach figures for aspects of the media campaign and all of the creative aspects. So across the 10 countries and the media landscape. And then we were really trying to measure awareness. So we were looking at sort of the reach figures along with this survey that was done through a company called Geopol, and I'll read the quote from Geopol in just a second. And then we were also looking at engagement, so like measuring the engagement. So we had quite a number of social media campaigns through the various platforms, and so that was how we were looking at engagement. And then impact was this measure through Geopol. So the Geopol survey was a telephone-based evaluation survey, and it was sort of the primary evaluation route for getting beneficiary feedback and measuring the campaign impact. That said, telephone surveys present some barriers for people with disabilities. For example, people with hearing impairments, intellectual disabilities, or people who are nonverbal. So we really advocated for embedding disability questions into the survey. It was tough just because the team, Geopol, had not done this before, and they were reluctant because there was already a big list of questions. But that said, we were able to really embed some, and we're actually in talks with Geopol now of how we can embed some of these questions into their future surveys. So not just our work, but their work globally in general. So we had an inclusive approach that was piloted with Geopol in Ghana and Nigeria, targeting to people with disabilities. And it was a self-administered web-based survey aiming to reach 30 people with disabilities in Nigeria and Ghana who couldn't participate in the phone surveys. And so just sort of finally, we in those countries, we liaised between Geopol and disabled people organizations to identify people with disabilities to be involved in those surveys. And I would say that the approach was largely really successful, and the data that we gathered in the larger sort of report, I really managed to reach a lot of the people who are traditionally marginalized. So people with deafness or blindness, intellectual disability. So I'll quickly read the quote from Geopol. This process is giving a voice to people who have disabilities. This business doesn't have a packaged solution to this that is not expensive. Working with Sightsavers and similar organizations to find the solutions together, it has worked very well. So that was from Geopol. So it really was, I think, broadening Geopol and other international partners' perspectives on inclusion. So back over to Amy, I believe.
Great, thanks, Geordie. So moving on then to what we have learned. So this has been a really rich learning experience because we felt that the Ascend COVID response was quite unique, really. And we were really grateful for the opportunity from FCDO to adapt the programme. And as far as we're aware, it was the first time a large-scale integrated NTD programme had delivered a more inclusive and accessible SBC campaign, which used a mass media approach. And we're really proud of that and remain open to be challenged on that. So across West and Central Africa, the government partners and Ascend partners have been on a learning journey with this. And through the interviews that were analysed, many respondents reported an increase in knowledge, awareness, and enhancing their capacity. Will someone just mind using their microphone? Thank you very much. So respondents reported an increase in their knowledge and capacity on what inclusive and accessible SBC looks like in practice. So Sightsavers, the Geopol teams, and M&C Saatchi all expressed that they had acquired new knowledge as being part of this project. And they conveyed a strong commitment to taking this forward and embedding this learning into their respective organisational systems and structures and their future projects. So we've got a few quotes on the screen here which kind of illustrates this. So the Sightsavers teams felt that the SBC materials were much simpler, clearer and more accessible. And others reported that they really wanted to kind of do inclusion better in our NTD work, as it is a strategic commitment. And people felt that they hoped that by incorporating these inclusive elements, that it becomes more expected and is more consistently done. And then from the M&C Saatchi side, there were some reflections that staff would certainly make sure that they would consider accessibility and inclusivity in their future when they're developing communications for other organisations. And M&C Saatchi are a huge global creative agency, so to influence their communications people and their future mass media campaigns on inclusion is a real huge achievement in itself. So next slide, please. So here we're going to touch on the recommendations that we've come up with for future projects. So as Cathy mentioned, the findings from this learning review have now been written up into a learning brief, and a link to this document will be shared when the recording of this talk goes round. So we encourage you all to read that. And we have a summary here of some of the recommendations. So these were developed following the analysis of the qualitative feedback that was gathered through those interviews. And we hope these recommendations do inform future projects to promote inclusive and accessible SBC. So we recognise that none of these are necessarily kind of hugely surprising or necessarily mind-blowing, but we know now from direct experience and have put it into practice. So we do hope that these are helpful for other teams to look back on if they're planning a future SBC campaign. So the first point is just recognising that it's really important to create a shared understanding upfront and seek out that technical expertise early on. And this is particularly the case when working with partners who may not be as familiar with the principles of the Leave No One Behind agenda. And we found in the interviews that some respondents felt that if we'd done this a bit better, then it would have potentially saved a lot of time and reduced some of the amendments that had to be made further down in the design process. So secondly, this of course is recognising that this all costs money. So we certainly need to make sure that there is sufficient budget and staff time available to really embed inclusive and accessibility into all aspects of the design process. And wherever possible, this should also include formative analysis and pre-testing if possible. And this is really important to have the adequate resources just to make sure that our ideals around inclusive and accessibility can really be taken forward and put into practice. And thirdly, as already mentioned by Cathy a lot, so communication style is extremely important, particularly in an emergency situation. So next slide, please. So a further recommendation was around humanising the impact of inclusive and accessible design on the people that you are intending to reach. And it really helped by giving real life examples, because it helped create empathy for this recommendation and really securing kind of buy-in from stakeholders. The next point on here is focusing on ensuring meaningful participation. So engaging groups that represent persons with disabilities. So this can't be an afterthought. And we had specific experience in some of the countries, such as Guinea, where we engage with persons with disabilities, and it made the experience a lot richer. And likewise, this also was the case in other countries such as Ghana and Nigeria. So the next point here has also been previously mentioned, is around this point on being prepared to coordinate and collaborate with government partners and making those compromises. So particularly in an emergency situation such as the COVID response, it required working with different partners, so national task forces and also information and communication departments. And so it was really time consuming, but working across all of these different ministry departments really helped kind of strengthen advocacy efforts around the need for inclusive design. And then the last point on this slide is what Geordie touched on. So making sure that applying inclusive and accessible principles applies in the context of monitoring and evaluation. And this is important to reach people with disabilities who otherwise wouldn't be included in monitoring data. So these are just a summary of the recommendations. So there's more details in the brief, which we'll share. And I'll hand back to Cathy now, who will touch on some of the more specific Sightsavers learning points.
Thanks, Amy. So outside of the learning brief, we also put together a kind of addendum specifically for Sightsavers, because we realised that some of the findings were very specific to us. So I've listed 4 here on the slide. The first one, which was interesting, is we know that Sightsavers has accessibility guidance, a brown book, but what we found during the interviews was that many of the staff in the Ascend project weren't actually either aware of them or hadn't had time to read them and absorb them, and were not quite sure how to use them. So perhaps within Sightsavers, we need some training or on-the-job coaching during projects to help staff to be able to make sense of that guidance, and like Amy talked about, humanize it so they understand why they need to make some of those adjustments that are in the guidance. Secondly, we probably need a little bit of clarity internally about what is good enough. What are our minimum requirements for inclusion and accessibility when we design interventions? What are some of our good practice examples of developing different assets like TV commercials, printed materials, radio, drama, all sorts of interventions? And then what is our ideal? What would be the best thing that we're aiming for if we had the perfect amount of time and budget and scenario and consortium? Just so that people know what kind of levels we're aiming for, it might be useful. Amy's already mentioned this, but I think more systematically we need to embed money and time for inclusive and accessible design of interventions. And that includes budget for monitoring and evaluating how well our interventions are creating change. And finally, perhaps we could improve our internal system on how projects, especially complex consortiums and bigger projects, can access Sightsavers expertise on accessible and inclusive design. Andrea provided support to this project, but we have a vast range of skills and expertise in our design team and our communications team, which we didn't use. How can we tap into our expertise and use that creatively in our projects? And over to Geordie just for the final slide.
Thanks. I'm also going to ask my colleagues to jump in here, as I see this slide has changed quite a bit since last time I saw it, if I've missed something. But I just looking kind of at next steps and where we're going from here. I think, first and foremost, I'd like to sort of emphasize, I think that sort of building on what Cathy was just talking about, that I think that one of the big next steps is to continue this sort of cross-directorate collaborative approach. I think that we've got so much more out of this work by working across teams, and I think that Sightsavers over the years has gotten much better at that. But when it actually really comes into practice, I feel like we really get a lot more done, and the work becomes a lot richer. So I think that that's the main thing I would say in next steps in terms of what this work reflects. And then sort of more specifically, in sort of internal, we've just led 2 pause and reflect sessions with MNC Saatchi on this work, with one in French and one in English, and making sure that we can really kind of draw out all of the lessons learned, what worked, what didn't work. Perhaps more importantly, we're having this lunchtime talk internally, and then again, the circulation of that social behavior change learning brief that we'll disseminate along with the slides from this presentation afterwards. Externally, we've got the International Disability and Development Consortium case study, and just develop and disseminating that. We were just recognized by the ISNTD organization at their festival. Then Sachi was given an award for the social behavior change work that was done on this. Making this up and available on various global websites, so across NTDs, presenting this at global conferences such as the NNN. Another thing that's not listed here is the International Health Communication Conference that is set to take place, or was set to take place in Morocco, and will now be in 2022. So hopefully by 2022, we'll have even more really interesting examples of this type of work. So I'm going to let others who have anything else to say on next steps jump in, but it's been a great process, and I'm looking forward to the next version of this.
Great, thanks, Geordie. I guess, yeah, just to add as well, I think we're obviously doing this internal talk today, but we also do want to try and do a bit more of an external facing talk as well, so directed at specifically towards like FCDO and our consortia partners, and also partners we work with in our big disability programs. So that's something hopefully we'll do in the next couple of months as well. So that's it from us. That's all the slides that we had to run through. So we'll welcome any questions that you may have.
Great, thanks, Amy. Yeah, so we have about 10 minutes for questions, and I believe I did see one in the chat box. Let me just get back to it. So Sapana has asked, I am wondering, how do we ensure meaningful inclusion if we continue to view lack of time and budget limitation as barriers? What can we learn from this so we can ensure inclusion despite time and budget constraints?
Oh, good question. I don't know who wants to
Andrea,
take that
do you
one?
want to take it on first? And I can follow up.
I can try, yeah.
More money.
I think, well, thanks, Geordie. Yes, the short answer to that is more money. But I think that's an absolutely brilliant question. And yeah, I guess we just need to, first of all, understand that lack of time and budget cannot be a justification. I think that's the first point. I think we need to understand a bit more what are some of the costs that we need to think about, because a lot of the recommendations, a lot of the good stuff that came out of this project doesn't really cost much money. It's just about choosing one font or another. It's about choosing one type of approach or another. Some things do cost money. For example, you need to hire sign language interpreters, or you might need to hold consultations with people. So there are those aspects. I think it's not a justification, but we need to acknowledge, I think we need to appreciate the scale of this project. I think the scale and the topic of this project were unprecedented for Sightsavers. And the other thing that was unprecedented, I think, was the level of collaboration between different teams. I remember sitting with Geordie in Chichester many years ago thinking, hey, can we work together? Can we do something together? And a few years down the line, this is one of those results. And I think this was the best example of collaboration between different teams on a communication campaign. There's a lot more that needs to be done. I think the concept note, I believe, I wasn't involved in development of concept notes, for example, but I think they were developed in 10 days and submitted. So that's why they didn't fully include all aspects that they could have included. But what we're trying to take those learnings and embed them. So we're exploring new opportunities around COVID, and we are trying to have a more inclusive approach from the beginning. In terms of engaging with organizations of persons with disabilities, there's also a couple of other aspects. I think one is the availability of connections at the country level. Some countries, some of our country offices are better placed than others to mobilize those connections. Yeah, but I don't know, Cathy, I don't know if you want to add to that.
No, and I think Sapana has said, given budget cuts, we need to think beyond money and time. And I think you're right, Sapana, it has to be embedded in our policies, our approaches. You know, that the SN program and NTDs have their Leave No One Behind framework, which should frame everything that is happening within that program. I don't know, Amy, if you want to talk about that, but yeah, it does have to go beyond time and money. But I think Geordie's got a train in the background. There is a compromise between everything, and I think that's what we found through this learning review. There is compromises between reaching scale and number of people during an emergency and inclusion and accessibility, which I think was met really well. Yeah, Amy.
Yes, so yeah, I guess more broadly on Ascend, we do have an explicit focus on Leave No One Behind. So each of the countries had to produce like a country level Leave No One Behind strategy, and then the program's got an overarching strategy. And yeah, we get a lot of feedback from FCDO and TPM on this, which is very in depth. And yes, I think it is an element of the program that does need to be improved, because I think a lot of those country strategies haven't necessarily been consistently operationalized, and also it's probably not been resourced well enough, I think, within the consortia. So it is a big area of improvement, and I know we have like a Leave No One Behind working group on Ascend, and yeah, something that we're going to have to talk about, because one of the big gaps was a kind of bit of a lack of monitoring framework in relation to this. And now, of course, with all of the FCDO budget cuts as well, it adds another challenge for us to grapple with.
Yeah, and before Geordie, before I go to you, maybe just also to say to everyone who's not in NTDs, I think this is so relevant for all of our work that we do around behaviour change. Making sure our materials are accessible and inclusive should just be the standard of what we do. And we're currently developing a social behaviour change toolkit, and that will be embedded within that at all stages. So making sure that our systems and processes just automatically reflect inclusion and accessibility so that it becomes the standard, I think is something we're aiming for across the organisation. Geordie, yeah, you've got your hand up. I don't know if anyone else does.
Yeah, Ruth has her hand up, and I think Geordie just said, given the freight train in the background, he's just going to write his comment in. So I can read that out once it comes through. But go ahead, Ruth. Oh, Ruth? No? Okay.
I can put my comment in the chat, but just to I think it's great, this document, and the fact that it is shareable, and that we're learning from this, what's happened in this campaign. In the practical way, the way I saw it in Benin, Guinea, especially because those two countries, I was privy to all of the meetings with Andrea. I did find that targeted technical support was amazing, and the practicality of the advice was also very helpful. So I know that is already compiled in other documents and in other spaces, but I think that is something we all need to do. And I could see the teams in the countries, the MOH, becoming the advocates for inclusiveness, for being inclusive, right after these meetings. So it built capacity, and hopefully we're doing our best to try to put all of the learning into the COVID, the NTD campaign, thanks to the support, and we're trying to be systemic, involving organizations of people with disability in Ascend.
Thanks, Ruth. I think, yeah, building the capacity across the organisation in accessible design and inclusion is definitely one of our internal recommendations. So design team, if anyone's online as well, I'm going to come and talk to you and knock on the door.
Thanks, Cathy. And just to go back to Geordie's comment, he said, building on Andrea's comment, the more clearly we can be specific about the specific elements and budget lines, we will save time and can embed in our processes. So. Well, I mean, we've only got 2 more minutes, so I guess if there's any pressing last question, we can ask it, but otherwise, I mean, thank you all so much for attending, and Amy, Cathy, Geordie, and Andrea, thank you so much for sharing these learnings with us. They're really informative. So yeah, thank you guys all so much, and the recording will be shared around at a later date, along with the briefing that you've put together. So yes, thanks.
Thanks, everyone.